You're listening to A Small Dose. I'm Dr. Charlene McCormick, a registered pharmacist, and I'm here to provide you information on medication treatments for various diseases. My goal with this podcast is to provide you the information you need about your medication so you can make informed decisions and be in charge of your health. Disclaimer: the materials and content provided in this podcast is intended for general information only and are not to be considered a substitute for professional medical advice, diagnosis, or treatment. Hello, and welcome back to A Small Dose, where we aim to provide you with the information you should know about the medication you're prescribed. Today's Small Dose is all about levothyroxine. Levothyroxine is approved to treat hypothyroidism, also known as underactive thyroid. It is also used for other conditions that require suppression of thyroid-stimulating hormone, better known as TSH. Levothyroxine is a medication used to replace a hormone normally made by your thyroid gland. This hormone helps to regulate your body's energy and metabolism. Signs and symptoms of having an underactive thyroid include fatigue, constipation, dry skin, weight gain, thinning hair, and even depression. This is not an all-inclusive list, but these are a few things that may trigger you to go to your doctor for a checkup. Your doctor will order a blood test to check for levels of TSH. TSH is what tells your thyroid to either produce more hormones or to fall back and produce less. When your thyroid is underactive, your TSH level will be higher than the normal range. This is a general statement, as the cause of your hypothyroidism may actually result in low to normal TSH levels, but that starts to get into the complicated territory having to do with your specific diagnosis. So what role does levothyroxine play into this? Well, your thyroid makes T3 and T4. T4 is the hormone thyroxine and T3 is the hormone triiodthyronine, a tongue twister that I will not say again. T3 is the active hormone and your body converts T4 to T3. Levothyroxine is a synthetic form of T4. Levothyroxine is also known by several other brand names including Levoxyl, Synthroid, Tirosint, and Unithroid. The dosing of levothyroxine varies greatly from as little as 13 micrograms to as high as 300 microgram tablets. Your specific dose will depend on your current levels and your body's response to the prescribed dose. Once you are prescribed levothyroxine, you should take it in the morning on an empty stomach, about 30 to 60 minutes before you eat. If you prefer to take it in the evening, it should be taken 3 to 4 hours after your last meal. The reason for this is because different foods can affect absorption rates of levothyroxine. For instance, soy, grapefruit, espresso coffee, dietary fiber, even walnuts can change how much levothyroxine gets into your bloodstream. Keep in mind that levothyroxine will bind to products containing iron and calcium, so make sure you separate it from vitamins. I'll touch more on this in a bit. When taking this medication, your doctor will monitor your TSH level as well as T3 and T4. This will usually occur 4 to 6 weeks after treatment is started and anytime your dose is changed. It will then be monitored after that at roughly 4 to 6 months after your dose is established, then finally every 12 months or more frequently based on your specific situation. In most cases, brand and generic medications can be alternated without any issues. However, switching between levothyroxine agents is one of the few times where going between brands and generic options can cause fluctuations in your TSH level. For example, if you are started on generic levothyroxine and your level is stable, switching to the brand Synthroid at the same dose may result in changes to your TSH level. The same can be true if your levels are stabilized on Levoxyl and you switch to Tirosint. There aren't any studies that show one product is better than the other. It's just important to stay with the version on which your TSH level is stabilized. Now, let's get to the side effects. All medications have the potential to cause side effects, and levothyroxine is no exception. There aren't any reported percentages on which side effects occur more often, so I just want to point out some you should be aware of. This includes irregular periods, excessive sweating, chronic trouble sleeping, feeling anxious, weight loss, and high blood pressure. Some of the rare but serious side effects include abnormal heart rhythm or fast heartbeat. Don't ignore this reaction. Seek medical attention if you experience this. Some of these side effects your doctor can monitor for, like your blood pressure, but others you will need to let your doctor know about. This is where taking your health in control is important. You need to advocate for yourself and speak up if you are experiencing troubling side effects. I also want to point out that using levothyroxine long term can result in decreases in your bone mineral density. So women, if you are postmenopausal, you want to take the lowest dose required to maintain your hormone levels. Now I want to take some time to discuss interactions. I mentioned earlier that levothyroxine can bind to iron and calcium. Be aware that many vitamins have calcium and iron, but other over-the-counter products like Tums also contain calcium. A good rule of thumb is to wait at least 4 hours in between these products. To make it easier on yourself, take your levothyroxine in the morning on an empty stomach and take your vitamins with dinner. There are prescription products that may have interactions with levothyroxine as well. These include lithium, amiodarone, and some antidepressants. Taking these medications does not mean you cannot take levothyroxine. It just means that if you start or stop these medications, your hormone levels should be checked again to ensure they remain within the goal range. Again, this is not an all-inclusive list, so check with your pharmacist if you have questions about your other medications possibly interacting with levothyroxine. So let's see what this will do to your wallet. The pricing between the different brands vary greatly. If you have prescription coverage, call your insurance company to see which product is on their formulary. There is likely one of the products they cover at a cheaper cost or copay than the others. The insurance terminology for this is preferred agent. If you don't have prescription coverage, this is the order from least to most expensive. Generic levothyroxine will run you about 50 cents to $1 per tablet. Levoxyl is about 80 cents to $1.50 per tablet, followed by Synthroid at roughly $1.45 per tablet. Next is Unithroid for about $3.30 per tablet, and the most expensive is Tirosint at $5.12 per capsule. As you can see, a 1-month supply can cost you as little as $15 to as much as $150 if you don't have prescription coverage. These are average wholesale prices, so you would need to verify the actual cost with your local pharmacy, but this will at least give you an idea of what to expect. A few of the brand name options have manufacturer coupons available on their website, and this may help alleviate some of the cost. Make sure to read the fine print, however, because there may be limitations on how many times the coupon may be used, or even limitations on who qualifies to use these coupons. Well, that's all I have to share on today's podcast. I hope you enjoyed your small dose about levothyroxine. Tune in next time for another small dose. Look for a small dose on Instagram, Twitter, or Facebook. Check the description box for links. Leave a comment if there are any medications you want to learn more about. I'm Dr. Charlene McCormick, and thanks for listening to A Small Dose.